My friends, this is the video you have waited for. We have an update on how to have better pain control during IUD insertions. Literally, I'm gonna give you handouts that you can bring into the office and say, I would like this. So let's get going. Hey everyone, I'm Dr. Jen Lincoln, board certified OBGYN, author, educator. Welcome to my YouTube channel, the health class you did not get in high school. Go ahead and like, subscribe, turn on the bell so you never miss an upload. Okay, I have previously done a video on IUD insertions and what you can ask for, and I still think it is an excellent video that goes into a lot of detail, but this is the update we needed. There are some new guidelines from the American College of OBGYN that talk about better ways to control pain during IUD insertions, and I am covering them today so you can go in to feel informed and empowered when you get your IUD and not scared off of what you see on IUD TikTok or just a prior bad experience that you've had. Why does this matter? Because we don't want things to hurt if they don't have to. And the unfortunate part is that for some people, having an IUD inserted doesn't cause any issues at all or is only mildly uncomfortable. But for others, it can be way more intense and there's no real great way to predict how you're gonna react until you're doing it. So unless you've had one before, you might not know what category you're gonna fall into. So it's good for everybody to hear these options about pain control. So I'm just gonna put it right up here on the screen. This is the first one. And like I said, I will have these references in my show notes, but this is the part of the table that just talks about evidence-based ways to control pain with IUD insertion. This paper covers lots of different GYN procedures, but today I'm just talking about IUD insertions. And the second one that you'll see here is also from a paper that was just put out in May 2025 that talks even in more detail about pain medication and other ways to manage pain that you can also print out, bring in and say, hello. This is what I hear I can have as an option, all in my reference list. So let's dive into your IUD pain control checklist with 5 things that you can ask about. The first one is local anesthetic or numbing medicine. Now there's 3 different flavors of this that I'm going to discuss. The first one is called an injection into the cervix or next to the cervix called a paracervical block. This is when we use a needle to inject lidocaine into the area where we use the tenaculum or the grasper on the cervix as well as to the sides of the cervix to numb up the nerves that go into the cervix and into the uterus. This one has the highest evidence in terms of what I'm recommending today. And the main benefit is that in the studies we've seen, this kind of paracervical block reduces pain by 40% when compared to no block. Now, there are some drawbacks with it. And the biggest one is that the injections themselves can hurt. And this is why for a long time, a lot of OBGYNs didn't routinely offer this. And I still think it should be a risk-benefit discussion of what you might think you might want or not want. And there's no right or wrong answer. It's just the ability to have a discussion and choose what feels right for you. I can disclose for you, I've had a few IUDs now, and I've never had a paracervical block because I never wanted those injections, but I did have a tiny little injection of that numbing medicine on that tenaculum site. And for me, I did beautifully, but that's me. That's not everybody. And so it's important that you feel empowered to choose what feels right for you. The other risk related to this injection, very rare allergic reactions, or sometimes you might feel a little numbness or tingling on your tongue, which is normal and is not an allergic reaction. There's also a risk of something called a vasovagal, where your blood pressure just kind of drops, but this is not super common. The second type of numbing medicine is either a spray or a gel of that same kind of numbing medicine, but instead of an injection, it's a gel placed on the cervix or a spray on the cervix. Now, what are the benefits of this? No shots. We love no shots. The downsides, it's just that it's not as effective as the injections themselves, but it can be a happy medium if you want something, but you don't want that needle. And the third thing is something called hysteroscopic lidocaine, or where we put the lidocaine and the numbing medicine directly into your uterus. The benefit is that this has been shown to work compared to just putting like water in the uterus, but it's not a huge benefit. And the downside is putting something like that into your uterus even before the IUD can cause more cramping. So it's not something that I see offered all the time, but it is definitely an option. Okay, moving on to the second thing that you can request on your IUD pain control checklist are NSAIDs, or non-steroidal anti-inflammatory drugs. So think ibuprofen or Aleve. Now it's important to note that taking these medicines doesn't help the actual IUD insertion. It helps with the cramping and the discomfort afterwards. And so if you're gonna pick one, the most data is actually with Aleve. So you can take these 30 to 60 minutes before your IUD insertion. You can also take them, later that day and the next day as well to help with that cramping. Pretty low risk medication to take and try. So if you don't have, stomach issues with taking these medicines, it's not a bad thing to do. The third thing that you can discuss are sedation or anti-anxiety medications. So for folks who are really worried about it, or they have a history of a really difficult IUD insertion, a known history of things like vaginismus or really tight pelvic floor muscles, or a history of trauma or assault, these may be necessary. And it can come in the form of medicines you take by mouth, medicines in your IV, or inhaled medicine like nitrous oxide. Oftentimes, when you need these, you need somebody to drive you home. And so it's important to note that sometimes if you were planning an IUD and you opt for this, you may need to come back a separate day. And some offices don't offer this and may have to have you have your IUD placed in a, like an operating room, like an outpatient procedure center or something like that. But I do know a lot of offices are offering this more and more within their own clinics. So it's worth asking about. Now, if you're asking Dr. Jen, why don't all people who want an IUD, why aren't they all offered sedation or to be knocked out completely? And the answer is because most people don't need that. And it's also in and of itself a risk. And it costs money, and a lot of insurances don't cover it. So that's a big part of it. But the other thing is that most people don't need that. So it's important to ask for it if you think you might, but it's not something that we routinely offer for everyone for the reasons that I mentioned. The fourth thing on the IUD pain control menu is cervical preparation. So this is using medicine to help soften the cervix and open it up a little, with the idea that makes it easier to insert the IUD. And what I'm talking about here is misoprostol or meso. Now, this is not routinely offered, and that is because the side effects of it kind of suck. And in studies we've looked at, a lot of people have said they wouldn't have used it again if they didn't need to. It can make you cramp, it can give you a little fever, it can give you diarrhea, it can make you nauseous. So it's best to reserve this for folks who've had a difficult insertion before or have a specific scenario. It's not something we recommend for everybody to use just as a blanket statement. The fifth thing on your IUD pain control menu might sound kind of fluffy, but it's things like distraction tools, like bringing a friend or listening to music, or even inhaled lavender has been shown to help because it helps to kind of reduce the anxiety. Talking to your provider beforehand, knowing what to expect, knowing that if you say stop, they will stop. These are all things that we know help people. And it's not meant to just say, oh my gosh, my doctor just said if I inhale lavender, I'll be fine. No, these are all part of a bigger menu of items that you can choose from, but it absolutely can help. What if you go into the office, you ask for an IUD, you mention some of these things, and you're brushed off? Maybe you don't want to go there, and I'm hoping that the tide changes, especially as we have more discrete guidelines that are coming out and saying, you need to offer these things to people. I'm hoping that will change the culture. I think it's really important that we continue from within to advocate and speak up, but you as well. You can walk in empowered and say, I know I have access to this and I want this. And you can give feedback if you're not getting that. Okay, share your stories. Let me know what you think about having this new resource, and tell me your experiences. I would love to hear it in the comment section. All right, till next week, my friends, stay safe.